Thank you very much. Nothing like walking into a room and going straight onto the stage. But look, thank you very much, and can I acknowledge Karen, who always does an amazing job in terms of being MC, and also to Catherine as your new CEO. Well, it's the first time I've been here when she's been your CEO in residence, and it's fantastic to see the incredible work that she's done in the 12 months that you've been the CEO of this amazing organisation. So I acknowledge the incredible work that you've done, but most particularly, can I just acknowledge everybody in the room. Nurses are the backbone of our community, and it was really interesting. I've had the pleasure over the last month of being away, and I was in London and I went to the Museum of Modern Art, and interestingly, when I arrived, they asked me if I was a nurse, and I thought this was a terribly odd question to be asking. Do I look like I'm a nurse? I don't know. But the reason they did that was because they said, we want to pay respect to all of our amazing nurses and everything they do in our communities every day, so we don't charge nurses to come into the Museum of Modern Art in London. And I thought that was just a lovely gesture. And throughout the exhibition there were reminders, and there were a number of different exhibitions. There were just little reminders all the way through the exhibition about the incredible work of nurses, and one that stuck with me was an incredible one in the Robbie Williams exhibition, where it just said, not all heroes wear capes, and there was a picture of a nurse in scrubs. So I acknowledge the incredible work that you do, but also acknowledge it is a worldwide phenomenon that the world loves nurses, and for very good reason. So great privilege to be here again. I have already chastised your organisers that it's not in Cairns, it's in Canberra, and explained to them that if they'd like me to come next year, we definitely have to be somewhere warmer. But much has happened since we last met in Cairns 12 months ago, or slightly more than 12 months ago. The Australian people have elected or re-elected their government after going to the polls. And, you know, quite clearly I was disappointed in the election result. But the reality is the Australian people have spoken, and I now retain the very important role of being the person who holds the government to account, because I'd be very, very delighted to have been reappointed as the Shadow Minister for Health and Aged Care. But I'm also delighted to say that I've also been appointed as the Shadow Minister for Disability in the NDIS. And I think the thing that was most important to me in that appointment was, I've long said that care shouldn't be determined by the silos of government and how government administers itself. Care should be delivered because of the needs of the individual who is actually receiving that care. And the ability to coordinate between health, aged care and disability across the whole care sector is something that I think provides me in this role enormous opportunity to look at it more holistically instead of the siloed way that unfortunately governments of all persuasions have tended to do in the past. So moving away from silos and looking at it holistically, and I also look forward to continuing to work with Mark Butler to make sure that we are, where possible, working together, because I think the Australian public expects their government and their opposition to be working in the best interests of Australians. So I will only have the fight where I need to have the fight, and where possible I will be absolutely cooperative so that we can put good policy forward to make sure that your lives are better, but also it allows you to do your job better, because by doing your job better, you're delivering the best possible care to the people who you look after every single day. So no question, there's still a huge amount of challenges that are out there before us. I mean, the election didn't change the challenges that currently exist. But as I said, it's a great new and fresh opportunity to put some real reform on the table, and I can assure you I'm really keen to be much bolder in terms of my response now that I've got to know the various stakeholders in the sector so much better. But as I did last term, I just want to continue to assure you I will engage. My door is always open, and because I don't have a department briefing me all day, every day, I rely on people like you and your organisation to keep me up to speed about what's going on at the grassroots level out there in our care sector. So I also equally see the situation going forward as a joint challenge and opportunity, and so I very much look forward to continuing to engage with all of the nurses of Australia to make sure that I understand what are the issues that you're facing so that I can take alternative positions to the government to seek the government to make sure that they are developing policy that reflects what is needed out on the ground. So, as I said, the nurses around Australia are, well, I think the 29th year in a row you've been elected or nominated as being the most trusted profession in Australia. I often look at that and think with great envy, because I can assure you that politicians are not anywhere near the top of that list. But it's a trust that is earned. It is earned by the compassion, the integrity, the skills that you provide every day to people when they're at their most vulnerable. So I wish to acknowledge that it's not just me that says that you are the number one regarded profession in Australia. You're probably the number one profession in the world. But as I said, we meet today when there's still enormous pressures on our health system. I'm not telling you anything you don't know when we talk about, Australia's facing an ageing population. We're facing a growing burden of chronic disease, the increasing demands on our hospital services, a worsening situation when it comes to mental health, and a persistent inequity when it comes to rural and regional Australia. These challenges aren't new, but they certainly are intensifying. So I was really pleased to see the title of your forum this year, Courage, Compassion, Connection, Empowering Nurses of the Future. And I think it's the word empowering that was the thing that jumped out of me in terms of the title of this conference, because I really do believe that the empowerment of every single person that works in our sector must be the driving force behind what we're doing going forward. Because unless we allow everybody to be empowered to operate to their best and highest capability, we will not solve the dilemma that we have around the access to quality and timely healthcare. So when we look at the challenges of the last few years, there's been no shortage of analysis around the challenges that are before us. In fact, when I asked the department last year in estimates how many reviews were being undertaken in the Department of Health, they actually told me they couldn't give me that answer because it would be an undue burden on resources to actually find that out. I thought that was a bit of a worry, but we did find in the incoming government brief that actually it was 70. So 70 reviews. I say the time for reviews is over and the time now is for action. We know what the challenges are. We've got the data, we've had the pilot programs, we've got all of the reports, and most importantly, we've heard your voices over and over and over again telling us what the challenges are that you're facing. So now is the time for us to translate that into meaningful system-wide reforms that actually put the patients and care at the centre of our decision-making. And there could be no more obvious example of this than the scope of practice review. And it's one of the most significant opportunities I think we have in order to create the efficiencies in our system that we need. And it's particularly true of the kind of work that you do all day, every day. And in the current context of workforce challenges and the crisis that we continue to face in terms of our care sector, this is a place that we really should be looking to implement reforms with some level of urgency. It's time for all of our health professionals to be working at the top of their capacity because, quite frankly, we do not have the luxury right now of having turf wars about who's doing what. We need every single one of you being able to operate at the top of your scope. And when you look at the opportunities, obviously it's great for the economy when we've actually got an efficient workforce working, but all of the things like improving access, making sure that we're taking pressure off our hospitals, strengthening our health comes particularly in rural and regional Australia are all things that we've been talking about wanting to do for a very long time. And as somebody who comes from a rural and regional area, I know all too well the impact of workforce shortages in my regions because it means people either don't get the care that they need or they're having to travel hundreds of kilometres away. And that doesn't make for efficient or fair care. So I must say I am a little disappointed that the scope of practice review still sits on the government's desk and we haven't seen a response. But I can assure you I will be pushing very, very hard to make sure that we don't just see a report gathering dust on the Minister's desk. It actually is implemented, because we need to do that in the best interests of Australian patients. But over the past 3 years, I've tried to make it my business to visit just about every area of our country, whether it ranges from, clinics in Tasmania, outback, Aboriginal controlled health organisations, whether from Darwin to Perth to Brisbane to Sydney to Adelaide. And one of the things that has struck me more than anything else is just how incredibly innovative the sector is, and making sure that they're continue to embed, particularly in some of our shallow markets, innovative solutions to continue to deliver the care that I know that you want to deliver to the people that you look after. So I'm very keen over the next 3 years to work to make sure that we make our system work to incentivise innovation, because it will be innovation that actually takes our care sector to the next stage. And I think, there is no doubt that you in this room understand what innovation is all about, because you've had to do it by a matter of necessity. So finally, can I just emphasise, I absolutely understand that meaningful reform only works when it is done with your profession, not to it. And that means that we need to continue to listen to everything that you say, because you're the experts in this area. The experts do not reside in this city sitting behind desks in departments. The expertise sits there out in the ground across the entire length and breadth of this country. And proper consultation actually means getting out there and listening to you and seeing what you're doing in your workplaces. So I am very excited about the opportunity to continue to come out and work with you and learn from you about what I should be doing as your representative in Canberra, and making sure that the policy decisions that we make are actually making your lives easier, your lives better, so that you can do your job better. So we're in the process at the moment of reviewing much of what went to the last election, because quite clearly it was overwhelmingly rejected by the Australian public. So that means that all of our policies are up for review. Our values never will be. Quality care, timely and affordable access to care will never change in terms of our value proposition, but we do need to look at what is the best way for us to deliver that. So that will be my focus for the next 3 years. I'll never deviate it from it, but can I thank you so much for the 3 years of support that you've given me as I've learnt about your sector. And thank you in advance for the next 3 years, because I will once again be relying on you to be my eyes and ears and my advisors as we work up our policies to take to the next election. My door's always open, and I thank you so much for inviting me again, and I look forward to seeing you next year, maybe in Hamilton Island. So thank you.
Thank you so much, Senator Ruston. And could I just say that I'm sad to have to tell you that we won't be in Hamilton Island next year.
Yeah. I'm not coming. Where do you want me?
So, just before you go, photographic opportunity.
Yes, it didn't happen if there's no photo.
No, correct. And the reason that we're in Canberra this year is that ACN is intent upon building our resilience -1 degree at a time.
You're welcome back again.
Thank you so much for coming and speaking to us. And just before you go, your comment about the need to implement reviews, we couldn't agree with you more. We would love to see the scope of practice review implemented. We would also love to see the National Nursing Workforce Strategy implemented.
Yes.
And while you're about it, 3 years, 3 things to implement: registered nurse prescribing.
Okay, I'm on the job.
We'll see you next year. Thank you. Senator the Honourable Anne Ruston, Shadow Minister for Health and Aged Care.